Hello, I'm Dr. Sarah Zarek from Harvard Vanguard's Copley practice. My colleague, Dr. Ted Yurkovsky from Chelmsford, and I will be talking with you today about new guidelines for Pap tests. Many women have grown up with the notion that the yearly Pap test is an important way of taking care of themselves. But over the last decade, due to extensive research, new Pap test technology, and a better understanding of cervical cancer, recommendations for the frequency of Pap tests have changed dramatically. We would like to help you understand why we at Harvard Vanguard have adopted these new guidelines, which have been recommended and endorsed by the American Cancer Society and the American Congress of Obstetricians and Gynecologists, among others. We do believe that these guidelines are appropriate and safe and may help us to avoid unnecessary and sometimes complicated medical procedures.
So let us review a little bit about cervical cancer, which is a cancer involving the opening of the uterus or womb. Cervical cancer takes many years to develop and goes through a precancerous stage called dysplasia. During a Pap test, cells are collected from the cervix and examined under a microscope to identify these precancerous cells. Since the introduction of the Pap test in the United States, the death rate from cervical cancer has gone down steadily, largely due to early detection and treatment of precancerous conditions known as dysplasia. In the last few decades, research has shown that women will not develop cervical cancer unless they have a persistent infection with the human papillomavirus, or HPV. There are over 100 types of HPV, and most women are exposed at some time in their lifetimes. HPV exposure and infection occurs through sexual intercourse.
What's important to know is that only a few types of HPV are known to be high risk for cervical cancer. The good news is that in most women exposed to HPV, their own immune system will prevent the virus from permanently infecting the cervical cells, much the same way that the body defends against viruses causing the common cold. In a few women, however, the virus is not defeated and lingers in the vagina and cervix for years. We now know that these women are the ones who might develop cervical cancer. Fortunately, tests are now available to tell if a woman carries a high-risk strain of HPV. It takes years for a woman to develop cervical cancer. High-risk HPV can now be identified and early precancerous stages can be detected and treated. Therefore, it's now logical and safe to space out Pap tests.
So what are the new Pap test guidelines? Pap tests are not recommended at all for women under age 21 because cervical cancer is extremely rare in that age group. Between age 21 and 30, women should have a Pap test every 3 years now. After age 30, women should have a Pap test every 3 years, but if HPV testing on the same Pap test specimen shows that she is not a carrier of high-risk HPV, then the next Pap test can be done in 5 years. After age 65 to 70, most women can no longer require a Pap test. Of course, there are exceptions to these rules. Women with a depressed immune system, such as medications like steroids and other medical conditions such as HIV/AIDS, or a history of in utero DES exposure, may need more frequent Pap tests. In addition, women who have been treated for precancer or dysplasia of the cervix will need a Pap test schedule designed specifically for them.
Over time, more women will have received the relatively new HPV vaccine. Large research studies show that we can expect fewer women will develop cervical cancer. While this vaccine is very promising, it does have its limitations since it only protects against 2 of the several high-risk HPVs. For now, women who have received the HPV vaccine should still receive Pap tests according to these guidelines. In summary, new national Pap test guidelines are the result of a better understanding of cervical cancer and the ability to test for high-risk HPV. They also acknowledge the potential fears and risks associated with excessive testing and treatments meant to prevent cervical cancer. Going forward, most women will need a Pap test every 3 years and sometimes every 5 years. Please discuss how these guidelines apply to your situation and make specific plans for further well-woman checkups and preventive health care.